Hello, everyone, and welcome to the PAPERI Bright Mind Series held in recognition of International Childhood Cancer Day, ICCD 2026. This series brings together voices from different disciplines and regions to highlight how the research, clinical practice, and health system can work together to improve outcomes for children with cancer. I am Dr. Nesreen Fathy, lecturer at Faculty of Nursing, Nile Valley University, Egypt. I will be your host for today's sessions. Today, we are honored to be joined by Mr. Ayire Adongo. Mr. Ayire Adongo is a public health expert and currently serves as a regional coordinator for Sub-Saharan Africa at World Child Cancer. In this role, he leads the development of strategies and oversees the implementation of projects aimed at improving the quality of life and the treatment outcome for children with cancer across several African countries, including Ghana. He is a faculty member and fellow of the Ghana College of Nursing and Midwives, where he contributes to the training of public health nursing and pediatric oncology nursing residents. Mr. Adongo holds a Master of Public Health, a postgraduate diploma in Public Health Management from India, a Bachelor of Science in Nursing, a Bachelor of Law, and a certificate in Sexual, Reproductive, and Health Rights from the WHO. He also serves as a national consultant for the African Leaders Malaria Alliance, ALMA. Currently, he is pursuing a Doctor of Public Health degree at the University of Port Harcourt, Nigeria. We are very grateful to have his perspectives as a part of ICCD 2026. Mr. Ayire Adongo, thank you very much for joining us today.
Thank you, and it's a pleasure to be here.
Okay, today we will discuss a different questions in relating to our issues related to pediatric oncology nursing. The first important issues is we'll talk about our nursing practice and training. From your experience, what are the most critical training and educational gaps facing pediatric oncology nursing today?
Yeah, thank you very much. So I will restrict my answers to Sub-Saharan Africa, where I serve, because that is where I see most of the challenges. Not because in the developed countries we don't have challenges, there is, but most of the challenges are in Sub-Saharan Africa because with regards to outcomes in low and middle income countries, especially in Sub-Saharan Africa, the survival rate of children with cancer is between virtually hovering below 30%. In most countries, it's even about 10% or less. So that is where the problem is. And one of the major problems is because of the gap in capacity building, especially nurses. Because in most Sub-Saharan African countries, we do not have specialized training for nurses in particular, and the health system, the nursing cadre are one of the most important cadres, and it is before you can improve outcomes in any health condition, you need well-trained and highly motivated, competent nursing force to be able to help improve the outcomes. But unfortunately, because of lack of the legal framework, most countries do not have curricula for the training of nurses. And because the legal framework does not exist, most of the training institutions do not even develop the curriculum. Either And not only because of the absence of legal framework, but they do not also have the capacity, and they do not also have the funding. Even if they have the capacity, they don't have the funding. In most African countries, most of the countries cannot even employ. So they go in for volunteers. And all these things makes our outcomes very, very worse. So this is one of the major problems. They are unable to develop curricula. The governments do not support the training of these nurses. And so the outcomes are so bad. So these are the problems that we have, which is a huge gap in sub-Saharan Africa in terms of the capacity building of nurses in pediatric oncology.
I think that will be a more effect lack of this curriculum in training and of nursing pediatric oncology in South Africa, mainly affect in patients' safety and outcome. Do you think that's?
Yes, yes, because nurses are the ones that spend most of the time with patients and families. And so, if we do not have specialized training programs for the nursing cadre to build their capacity and ensure that, because WHO requires that in terms of human resource, they should be adequate in number, they should be competent, and they should be highly motivated. But
Yes.
these are the problems. So
Mhm.
the competencies in terms of the development of adequate curricula for their training does not exist. In terms of motivation, there are no policies, government policies to ensure that when they are trained, they are recognized on paper and on their salaries. So how can they be motivated? So because of all these things, they are unable to give up their best. And then where the government even tries to do that, they are not able to absorb the required number, resulting in high burnout. So that also brings about poor outcomes. So there are multifactorial issues regards to pediatric oncology nursing, which we need to address if we are able to improve outcomes, just like we see in developed countries, to ensure that children with cancer get the need to be able to survive and thrive, not only survive and thrive. Because beyond the survivor, we need to ensure that they are well integrated into society. And we need nurses, especially, to also play. Not that others are not important, like the psychologists, the healthcare play therapists, they are all important. But nurses plays a lot of role in all the continuity of care for patients and
Yes.
children with cancer.
Yes. Do you think when we start to standardize our practice and protocols to do for children in cancer help the nursing and to implement the treatment protocol and the guidelines to standardize the nursing intervention for pediatric oncology for every different disease, that will be more helpful to improve in nursing practice and to make the nurses no more for focused for the types of disease and the outcome and the complication could be happens from the related to the treatment protocol.
Of course.
How the nurses can be faced these challenges out, how we can improve these things for the nurses to help them to standardize, and we can set a standardized treatment protocol for the nursing.
So treatment protocols standards are very important in the management of conditions, because we need the standards, we need the protocols for all the childhood cancer cases. And beyond the main medical protocols, we also need the standards for nursing care. But
Yes.
but but you also realize that it's a continuity. You need the nurses to be trained. We need to meet their criteria for
Yes.
ensuring adequate training, and we need a legal framework to ensure that they are recognized, highly motivated. Then we need the focused nursing standards for care and management, so that the nurses would follow these standards with regards to each childhood condition. If it is solid tumors, we need the standards for care to ensure that
Yes.
they know what to do in order
And
to
yes.
prevent treatment toxicities, so that they are able to identify treatment related dangers and manage them for nutrition care, because all these things are specific to childhood cancer care if we have to achieve better outcomes. So, even in the absence of proper training, most of the nurses do innovate. They try to do their best, even though that is exposing them to dangers, because childhood cancer management is a specialized area. If you are not
Yes.
trained very
Yes,
well,
you're right.
you'll be exposing the nurse to dangers. But once they are
Yes.
trained, they know what to do when there is a spill. They know what to do when a child develops mucositis as a result of, and they even know what to do to avoid some of the complications of mucositis, so that they are
Yes.
able to reduce the treatment
Exactly.
toxicities.
Exactly.
So
Yes.
the standards are very, very important, because
That,
nurses also have their own diagnosis. Besides the medical
yes.
diagnosis, a nurse must be trained enough to be able to use the standards to diagnose the child and the family in order to give family-centered care.
Okay, Tab, from your perspective, how the nursing can start to lead this initiative especially in our Africa regions, and when in your country or all the countries in Africa, we all together in Africa complain from the same problems. From your perspective, how to initiate to lead the nursing to lead this change and to setting standardized guidelines for the and the clinical guidelines and protocols.
Yes, so nurse-led programming is very, very important. And I would say that nurses, we need to recognize the fact that we are a
Mhm.
specialized and highly needed, respected cadres of the health system. Without nurses, the health system is not, that will not exist. We need to recognize this fact, because
Yes.
nurses most often do not think that they are very important enough. Meanwhile,
Mhm.
we are more important than any of the other medical professionals,
Mhm.
because the nurses can start a health system alone without anyone, but the other medical professionals cannot. We need to appreciate that fact. So the nurse-led initiatives are very, very important, because we know the nursing aspect best. So we
Yes.
need to be able to lead in our own front in developing our own standards, because nobody can develop it better than us. So we
Yes.
need to
You're
build
right.
nursing leadership. So, and that is why I am very happy about the the oncology nursing leadership program, which was funded by Amgen at the University of Health and Allied Sciences in Ghana, which brought together nurses in the oncology field to build their capacity on leadership, so that they can lead
Yes.
nursing programs. So these are some of the programs that we need to build leadership skills in nurses, to be able to lead nursing programs, to develop the
Yes.
standards, develop the curriculum, and train nurses, just like yourself
And
also.
setting is a policy, and the law regulates the nursing of pediatric oncology in general and in cancer to contribute and empower the nursing for this related to this practice.
Exactly. So we need people like yourself and all of us as mentors so that we can mentor each other, bring ourselves,
Yes,
bring increase our confidence to be able to lead and develop the programs because we can do it. And many of us are already in leadership positions and we are not doing bad. So that is a very good example for others because we need to do this. And it is only when we do this. And the good thing is that we understand the patient more and we
yes,
see the issues from the patient and the family easily, and we are better placed to be able to develop these patient family centered protocols that can help
yes.
improve nursing care and
Should
provide
be a part
quality care
in
in
development.
totality.
Yes,
Yeah,
you're
yeah,
right. You're right. You're right. Okay, the other issues we facing in treatment with pediatric and the caring of patient in pediatric oncology is the problem of nutrition, infection control, and essential care. What role of the nurses play in ensuring adequate nutrition and infection prevention for children undergoing cancer treatments? From your
yeah,
opinion, we can.
yeah. So and these are things that we are already doing. I already stated that we are more closer to the patient and the family. So any sign and symptom that is exhibited, we are the first people to pick it up, especially if the patient needs more nutritional care, if there are changes in appetite, there are changes in the intake and output, we are the first people to identify this and we communicate with the multidisciplinary team to know what best to do and to communicate with the dietitians and nutritionists on and then to find out what better nutritional uh, this thing uh, regimen that needs to be developed to match the patient needs, and we are also able to
Yes,
communicate to understand the changing dietary patterns of the child, and we are able to get this from the child, and we play with the child, so we are able to identify all these things and then to ensure that the best nutrition is developed, and then we also feed them if they are not able to feed by mouth per us very well. So we even feed them if it is by tube feeding to ensure that they are able to regain. We are the ones that check the intake and output to know
yes.
when.
And
So
what's
all
the
these
daily
things
requirements? Yes, you
exactly.
know, you're right. Oh,
So
yeah, and we
these
can put
are
it in curriculum, nursing curriculum in pediatric oncology,
yeah
how this part of nutrition and supportive care is very
needed
important for
exactly
complications and what and how that affects in the patient's outcome,
exactly
besides the costs and health
exactly.
care of the healthcare. Yes,
Exactly. And with regards to infection prevention, we spend 24 hours in the ward. So our hand washing practices and all that, which are part of the curriculum, and we are taught all these things. We are taught. So we are the ones better placed to ensure all this. And then with regards to giving medications and ensuring that there is no infection, we are also taught on what to do. If it is through the vein, we monitor the site and all that to ensure that there is no infection or there is no nosocomial infections within the ward. So we do the dusting, we do the cleaning, we also supervise. So all these things are within our remit, that we ensure that patients are treated in a very good environment that is devoid of microbes. So I mean, we are the masters in the world. So
Yes, we have a very in some time country have limited resources, and we need more resources to more care, improve care for our patient. But from your perspective, how with limited resources in Africa, uh, how to optimize our supportive care as a nursing, how from our the current we have resources can develop and improve our patient outcome, and try to be more as a standardized in our care to improve the patients and prevent the infection and improve the complication and improve patient outcome in supportive care.
yeah, so currently there is a high demand for nurses to get involved in quality improvement initiatives,
Yes,
and then imbibing research into the whole process. So we are
oh
able to
yes,
adopt cost-effective interventions that uses a lot of innovation to reduce cost. So these are some of the things that have been involved, but we need to do more, and we need to entreat governments to invest more into this. Spend a little bit. We know we don't have money, but we also need to provide some legal or policy framework to support the nurses in doing all these things, especially in the quality improvement projects. And then to also ensure that all these trainings with regards to quality improvement research are included in the curriculum, and then give the nurses that support to be able to implement these projects in the world, so that we can assess and come out with cost-effective interventions, resource-limited innovations that we can adopt to achieve better outcomes, just like is done elsewhere. Because there are a whole lot of cost-effective interventions that we can use within our limited resources to achieve similar outcomes that
yes.
we can achieve.
Oh, you're right. And this will be lead to us talk about the patients and the family counseling, how the nursing supported children and the family emotionally and practically throughout the cancer journey, and how to prepare our nurses for this, how to coping with the feeling and problems with the patients and the family, and how to be shifting from her own feeling and the patient and the family feelings.
Yeah, so these are things that we are already doing, but we still need a lot of support. We need official ways of ensuring that nurses are recognized to do more. Because when in Ghana, for instance, when patients comes to the ward, and then the nurses receive them, they go through the process, they get a diagnosis. The doctors usually will
Mhm.
start some counseling, and then once they are admitted into the ward, the nurses continue the counseling from there, because most of our patients have a lot of uh, psychosocial issues, and then they
Yes,
tend to deny the diagnosis, and then most of them would want to continue getting support from their religious leaders, either from their Muslim leaders or Christian, and then or
yes,
traditional thing. So
yes, you're right.
we try as much as possible to counsel them gradually, and also respecting their cultural issues, and then
Mm-hmm.
so that if they need a pastor or a priest to come and pray, they come and do that, and then we also continue the counseling from there for them to accept that they also need orthodox treatment to continue. And then they are also counseled on the side effects of the treatment, like the hair loss, so that they can accept it, and then we manage it counsel them, we support them. And there are also other organizations within the hospital setup that also helps in the production of wigs
Mm-hmm.
for the female patients who are who needs these things to ensure that they stay okay without losing a lot of this thing, stigma, to deal with the stigma of cancer diagnosis. And so the nurses play a lot of roles in these issues. And then we also have the psychologists, child life specialists who also are brought on board. But because these cadres are not adequate in number, uh, we, the nurses, play a lot of this role in the ward to ensure that they accept the treatment, and then they are able to go through that, because cancer treatment can at times be so invasive, and then the pain and all that. So we do a lot on these things, and even palliation. There's a lot of counseling
Yes.
and support during palliation to ensure that the patients go through a pain. I mean, not pain free, but at least their pain is alleviated during the palliation, and then we support them to go through that and onto dying, and then bereavement support. There's a lot of work for the nurses
Yes. The
through all
nursing
these
do
things.
a lot of
So
things.
it's
Yes.
a huge task for the nursing professional, and so it's important that we provide adequate capacity building. And besides
Yes.
that, the care of the carer is another serious
Yes.
component that
Yes, you're right.
is a very important thing, because it can be a very depressing environment, because the nurses have a lot of attachment with these children, and then when they die, it also have an effect on us. But the general public at times thinks that we don't have any feeling. We also have emotions. So
Yes.
we need that care as well to be able to stay fit, to be able to take care of the children and the families in treatment. So it's a lot of work. And so we need that support from government to be
Yes, we
able to
need
put.
support from system support to the nurses to strengthen counseling and communications.
Yeah,
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 and develop. Yes, we need to care of carer for the
yeah,
all the nurses. Yes, to be more effective when caring of patients.
exactly.
Yes, and that will be give us to the very important issues. Maybe we involved mainly in the practice and uh, relieve the very important issues can help us in develop the nursing in pediatric oncology. That is a nursing research, how the nursing research and developing evidence-based practice can be improved and more involved in and make quality improvement to improve in nursing pediatric oncology. Most of hospitals or most of our regions just consider and focused on giving the nurse to give the just chemotherapy in direct patient care, but ignore the importance of nursing research and how exactly can improve the outcome and the patient outcome.
Yeah. So first, number one is the fact that we need to provide continuous education for nurses. That's
Yes,
very important, and it should be local production. So in Ghana, for instance, we have the associate program for pediatric oncology nursing, which is recognized by law. And then we also have the fellowship program. So the fellowship program is embedded in it adequate research capacity so that
Uh-huh.
the nurses are trained on research methodology in pediatric oncology. That is very, very important. And so some of these nurses, once they are out, I know about three of the nurses that developed proposals and got grants to implement quality improvement projects in their respective hospitals. And it is because they had training in research as part of their fellowship training. So that is very, very important because once they are able to, one of them won a grant to implement a patient navigation program, and you see that that's a
No.
very important
Yes.
program for patient
Yes.
navigation. So
Yes.
the
You're
person
right.
implemented it and was fortunate to get another award to go for SIOP. So SIOP is another international forum where a lot of research is discussed. So they go to these international conferences and they learn more about research around pediatric oncology. So we need the continuous professional development for nurses to build their skills and knowledge and confidence so that they will get
Yes.
adequate confidence, they will get adequate exposure on what is going on
More
elsewhere.
empowered to the nurses.
Exactly, empowerment, so that they will
Yes.
be able to do more research within nursing care for children and families with cancer, so that they can do more and then to be able to improve on outcomes. So it is only when we do this that we can say we are building the capacity of our nursing force. In most African countries, the nursing profession is often neglected, which is very bad. And then they tend to focus more on the doctors. Nobody says they
You're
shouldn't do
right.
that, but you don't neglect the nurses. And usually they say the nurses are so many. And there are so many because they are needed in higher numbers than the doctors because they stay
It's the same
more
problems.
with the
Yes.
patient. So you need to build their capacity as well. You can't just train the doctors alone to specialize and then you leave the nurses and you think a general nurse can work in gynecology or
Yes.
oncology.
Exactly.
It doesn't simply work that way. So it's important that governments, policymakers recognize the fact that we need a highly trained and competent nursing workforce if we have to improve on patient outcome, irrespective of condition, whether it's oncology, is an infectious condition. We need well-trained, specialized nursing workforce in all areas, as well as the research, because you see most of the research that are conducted, clinical research or whatever, they are
Mhm.
often limited to the doctors. That is very bad. We need to ensure that we have a
Yes. No
quota
supporting to the
for the
nursing
nursing.
and don't have a fund very well to learn how the research, how to design, how yeah, not educated very well how to make a research study, and no fund to our to for publications. No, we
Exactly.
have different. Yes, exactly. You're
Yeah.
right.
Yeah. So we need to do that. If we want to improve outcomes, we need to ensure that we have a quota designated for the nurses so that nobody else takes that. And that quota must be filled by nurses for the research in different areas and adequately funded.
You're right. You're right. From your perspective, what policy or system level changes would most improve in pediatric oncology care?
So it is similar to ensuring that any part of the health system is given that attention for nurses. The health system pillars can be looked at in all these angles. And the good thing is that once you build the capacity of the nursing workforce in any area, it has a cascade effect. If you are
Yes.
building leadership, it has a cascade effect. So, in terms of policy, we must ensure that throughout the stages of the health system, if it is about leadership and governance, we ensure that the nurses are given proper recognition, ensuring that they have nursing leadership that looks at pediatric oncology, highly motivated, respected, and recognized to lead
Mhm.
nursing in all the areas. And if it is about service delivery, we need to ensure that the nursing standards, the guidelines, and everything are developed by the nurses. Others can take part, but we must ensure that nurses are leading the process. If it is about the infrastructure, if it is about logistics, we must ensure that nurses are capacities are built in this area to ensure that they are able to manage the logistics, they are able to manage the equipment, to ensure that the plant preventive maintenance, the nursing
Yes.
lead are
Encourage
leading on
speciality
it.
in nursing and
Exactly,
encourage the nursing to be more specialized in pediatric oncology and more
exactly.
motivated and more empowered financial difference.
Exactly.
Yes.
So
Yes.
we need to ensure that it has a systems approach in
Yes.
ensuring that the nurses are adequately, issues are addressed based on the health system approach. So that at the end of the day, it will have a cascade effect on all the other areas.
Yes, you're right. Um, which level, how we can nursing voice be better to present it in national cancer policy, workforce planning, and guidelines development. We need
Yeah.
to be put ourselves in positive way and how to motivate us our pediatric oncology nursing to be more hear voice,
Yes.
how we
So
can do more better.
we can do better if the system recognize and respect the nurses, ensuring that they are involved in all the stages. Because at times I find it very funny when, for instance, we have a childhood cancer society and we are being told that the president must be a doctor. Why? That is unheard of. Why should it be a
Yes.
doctor? Why shouldn't it be a
We need
nurse?
nurses in every committee. We need
So
part of
it
nurses in
has,
every decision and policy.
yes, yes. So
Yes.
when you say that, then it means you don't even know your work because it has to be any member of the multidisciplinary team that can lead. Who says doctors are different species? I chose to be a nurse because I wanted to be a nurse. Not that I can't be a doctor, I can be. But often, because of this idea that other professionals have better IQ, who says that? That is not scientific. So
Yes.
we
Right.
must recognize each other as equal in the face of everyone, and it has to be open. So we need to ensure that we need to realize that fact that we are all the same, given the same opportunities, so that we can all contribute freely, reluctantly, so that our ideas can all be heard. It is only when we respect each other that much, giving each other that opportunity to be able to bring out our ideas, that we can all be respected. And that is only when we can have better outcomes anywhere. Because when you deny that person, uh, you might be denying a lot of people the opportunity to get better outcomes because that person would shelf back and would not contribute adequately to the health system. And at the end of the day, the whole society will be losing. But when we respect the nurses like any other health professional and give them similar opportunities, then you realize that the contributions are wider. You have a general consensus. You get opportunity of getting many more ideas that can help the health system and then improve outcomes for everyone.
Yes,
So
and
it is
you're right.
by giving that opportunity to everyone and not deny others just because they belong to different professions. That is very myopic thinking.
If we wanted to improve the patient's outcome and improve the healthcare system services in our for our pediatric oncology, we need to put in the nursing to be must be sharing in cancer policy, must be
Yeah,
a part of this, and must be
exactly.
workforce planning for how to develop career paths for the nursing in pediatric oncology to more empowerment the nursing in these issues.
Exactly. Because in Africa, that is one of the biggest problem. That's one of the
Yes,
biggest
yes.
problem. Because apart
Together
from
in these issues.
yes, I
Yes.
don't know how best in Egypt you have developed a curriculum for this, but for Ghana, like I said, we have that curriculum. So once a nurse specializes and then has a fellowship in pediatric oncology, their salaries are enhanced. And that is what in Africa we need. In many African countries, we don't have this program. And then even in some of the countries, the government is not able to employ enough competent nurses. So and I think that we have what it takes. Just that the leadership, when you go to the ministries of health, scarcely will you see most of the nurses assuming leadership roles at the ministry level. So we are losing a lot because nurses, we are the health system. Then you go to the Ministry of Health, and then the government is engaging doctors and other people as the ministers of health, and the
Yes.
nurses are not there. Even when you go to the UN General Assembly, you
And
realize that
actually, the nursing will implement all this policy. The
the
only
program.
person will be implemented. So much should be a part from this.
Exactly. You go to WHO in Geneva. How many nurses can you count? You go to
Oh,
the
too
UN
much.
General Assembly, the World Health Assembly. How many nurses do you see there?
Yes.
I mean, so we need, as the global world, we need a system awakening to recognize and appreciate the nursing workforce because we are the health system. And until we
Yes.
realize this, to enable nurses contribute significantly to health policies, we would
You're
still
right.
not get there.
You're right. Now, this is my last questions in these sessions. As we
Mm,
mark International Childhood Cancer Day 2026, what
yeah.
message would you like decision makers to hear about the role of nurses in a childhood cancer care? What's your
Yeah.
voice? How to say it?
Yes.
What we need from decision makers?
Yes. So the message is straight and simple.
Yes.
Strengthening pediatric oncology nursing is one of the most powerful, cost-effective strategies to improve survival for children with cancer worldwide. Investing in training, supportive policies, safe staffing, because you know the numbers are a problem, and nursing
Right.
leadership. It is not optional. It is
Yes.
central to achieving equitable, high quality childhood cancer care. Nurses are ready to lead. Decision makers must ensure that they are supported and valued and heard. It is only
You're right.
then that will be able
Right.
to get very good contributions on the health system that can turn things around, especially in Africa, where resources are limited.
Yes, you're right. You're right. Okay, thank you very much, Mr. Ayar Adongo, for sharing your insights and experience with us today. Your reflections highlight the importance of many aspects for childhood cancer in improving outcomes for children with cancer. Actually, we need to put the nursing really to be a part of policymakers and the decision maker and the development the guidelines of the pediatric oncology care. We are very grateful for you contribution to the PAPERI Bright Mind Series and to the global effort to improve childhood cancer care. This conversation is a part of PAPERI Bright Mind Series for International Childhood Cancer Day 2026. Thank you for watching, and we hope this discussion inspire continued collaborations and action for children with cancer worldwide. Thank you very much, and we grateful to be with us today, Mr. And.
Thank you for having me, and thank you to all your listeners and audience.
Thank you a lot.